a person can experience a visual loss in many ways. Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today I am going to talk about what are all the ways by which a person experiences a visual loss. Loss of vision, already we have told, it can be decreased vision or defective vision. Loss of vision can occur in three ways. It can be a progressive loss of vision. It can be a transient loss of vision. It can be a sudden loss of vision. What is the difference between these three? Progressive loss of vision is something which starts insidiously, it starts gradually and it progresses slowly and it lands up in severe visual loss. What is transient loss of vision? You experience a sudden drop in your vision and that gets corrected within few seconds or minutes. That is called as transient loss of vision. Sudden loss of vision, it starts and it rapidly decreases your vision. That is sudden loss of vision. We can once again classify these three into painful progressive loss of vision, painless progressive loss of vision, painful transient loss of vision, painless transient loss of vision, painful sudden loss of vision, painless sudden loss of vision. So this way we can classify the vision loss. Let us see them one by one. First, let us discuss about the causes for progressive loss of vision. It is of two types. One is painless, other is painful. There are so many conditions in the eye that can lead to painless progressive loss of vision. The commonest conditions we come across are cataract, primary open angle glaucoma, refractory errors, except hypermetropia and pterygium. Cataract, as you know, it is the opacity of the lens or its capsule. It initially starts as a small opacity. When there is a small opacity, there is a small decrease in vision. When the opacity increases in its size and occupies the entire lens, then the vision reduces to the minimum. So it gradually evolves to reduce the vision. Next is primary open angle glaucoma. Due to various factors, the optic nerve is affected. One of the factors leading to optic nerve damage which can be corrected is intraocular pressure. So, primary open angle glaucoma, it starts insidiously and it gradually progresses over many years leading to loss of vision. So, primary open angle glaucoma is a preventable cause of blindness. It steals the vision slowly. It is called as thief of vision. So we have to screen everybody over the age of 35 years. Next is pterygium. Pterygium, you know, it is a subconjunctival elastatic degeneration of the conjunctival tissue that is encroaching into the cornea. This pterygium, when it encroaches into the cornea, it causes astigmatism. The more it encroaches into the cornea, more astigmatism it is going to cause, the more the vision will be less. So it is going to lead to progressive loss of vision. Refractory errors. Refractory errors, myopia, astigmatism, presbyopia, all these things, they develop slowly and as age increases, the power also, they go in the ascending order. So the vision gradually gets reduced over a period of years. Next is diabetic retinopathy. Diabetic retinopathy is very common in the community now. Even if the patient is having the blood sugar under control, the number of years of being a diabetic itself will lead to diabetic retinopathy. So any person who is having diabetes should be screened yearly to look for any development of diabetic retinopathy. So initially diabetic retinopathy will not affect the vision to a great degree, but when it goes for a extremity, the vision will drop suddenly. When the diabetic retinopathy involves the macula to start with, the vision will reduce initially itself. Next is age-related macular degenerations. Nowadays, people don't take proper nutritious diet. They don't have adequate amount of antioxidants in their food. So naturally, the retina, that too, the highest metabolic rate happening in the macula, that portion gets affected due to free radicals. So age-related macular degenerations is very common in people who don't take adequate nutritious food, fighting the free radicals that are developing in the tissues. Next is retinitis pigmentosa, one of the causes for night blindness. It is a hereditary disease. It develops and creates a tubular vision initially, and finally that vision also will be lost. The peripheral retina is the first thing that is affected, because retinitis pigmentosa is the disease of the rods. Next is corneal dystrophies and degenerations. Dystrophies is due to a hereditary problem. Degeneration is due to aging the problem, or it is due to any pathology in the eye that is leading to degenerations of the eye. Dystrophies are usually bilateral, degenerations are usually unilateral. We have toxic amblyopias. Smokers and people consuming alcohol over many years, they can develop optic nerve damage leading to toxic amblyoppias. Nutritional optic nerve deletions, that is nutritional amblyopia, people not taking adequate nutritious diet, they have deficiency of vitamin B1, B6, B12 in the diet, they lead to optic nerve damage over the years, that is called as nutritional amblyopia. There are so many other conditions causing painless progressive loss of vision. Coming to the painful progressive loss of vision, hypermetropia is one condition. Patient will have pain in their eyes. They will have brow ache. So these people, they develop painful progressive loss of vision due to the refractory error called as hypermetropia. Primary angle closure glaucomas can lead to progressive loss of vision with a mild type of pain in the eyes. So one type of primary angle closure glaucoma is creeping angle closure glaucoma. This type leads to gradual and painful, that is a mild pain and loss of vision over the period of years. Corneal ulcers. A patient developing a small corneal ulcer, if it is not being treated immediately, slowly these ulcers may increase in size. Particularly fungal ulcers, when it take a very long time to increase in size, so fungal ulcers, they lead to progressive painful loss of vision. In fungal ulcers, the pain will be there, but it will be very, very minimum. So these are the causes for progressive loss of vision. There may be so many other causes. We'll stop here. We will discuss about sudden loss of vision and transient loss of vision in the next videos. Thank you.